Age 27. Restylane or Juvederm in tear troughs or blepharoplasty. In the last 2 years, it seems as if my eyes have aged significantly. I have always had some form of eye puffiness, which has gone down significantly through controlling allergies with antihistamines. However, now that the puffiness is less of an issue, I still have tired-looking eyes. In my profession, I'm in front of the camera a lot, and this is affecting my confidence at work. Am I a better candidate for eyelid surgery, or should I try fillers first in the tear trough area?
Thank you for your question. If you're asking essentially what choice you have between tear trough treatment with Restylane or blepharoplasty. At the age of 27, you've noticed that there is a relative hollowing under your eyes, and at the same time there are these little puffy bags just adjacent to that area. Well, you've sent really good photos from different angles, and in my practice I see young people who have puffiness under the eyes every day. So I'll share with you what's been my approach. When someone first comes to me and is very concerned about this area, if they have really significant puffiness under the eyes, then it's unrealistic to try to camouflage that area with Restylane or any other filler. Essentially, when you fill the tear trough area, you're trying to blend and to create a natural contour that looks like you don't have bags under the eyes. With the popularity of the hyaluronic acid fillers and other things that have become solutions by non-surgeons to help people with bags under the eyes, I constantly see people come to me who have had too much filler, or they got filler that was just enough, and what it did was it made the bags look even bigger. So if your puffiness is relatively modest and low most of the time, then having a filler as a first-line treatment may be worth considering. If, however, the puffiness under your eyes is relatively constant and it doesn't change very much, then most likely in a situation like yours, I would recommend a transconjunctival blepharoplasty. Now, what that means is when I do a lower eyelid blepharoplasty in a younger person, I usually do the procedure from the inside of the eyelid. By doing it from the inside of the eyelid, I'm able to shape and sculpt those fat pockets which have pushed forward and created a bulge, and reduce them in a way so that they don't look like they're pushing forward anymore. Essentially, it's restoring the natural anatomy. Now, that doesn't mean that once I reduce the puffiness under the eyes, that's a definitive cure for the improvement in the appearance of the eye area. I always like to think of the eyes as not just as an isolated issue, but as the eyes and the cheek together. So if someone has relative hollowing from the eye to the cheek area, I also like to enhance that transition point, also called the lid-cheek junction. Now, that may mean that after this lower eyelid blepharoplasty, you may still want to do something to help with the pigmentation as well as the relative hollowing. So in my practice, I'll share with you what I do routinely. I use platelet-rich plasma or platelet-rich fibrin matrix, which is basically your own blood and the factors that are responsible for healing being concentrated after basically a simple blood draw, and then being placed underneath the skin so that there's collagen buildup, and there's also a stimulation of new blood supply. That combined with a volume enhancing filler like Restylane has been very successful in my practice. Now, there is an art to doing all this, and there is a lot of finesse, and this is where a lot of people end up getting in trouble. they'll be unhappy with the injectable, but rather it might be really the technique and the style employed rather than the material itself. So understanding your situation, I would probably, again, recommend considering transconjunctival blepharoplasty and maybe some skin enhancement or volume enhancement to the tear trough and the lid cheek junction area. Thank you for your question, and I hope that was helpful.